Good morning, everyone, and welcome today to our session on communicable illness. We're going to talk about flu season, but also we decided to talk about more than just flu season. We want to talk about some of the recent natural disasters that we've seen across the country and how those can affect employee absenteeism and communicable illness. This is part of our 2017 Crisis Coach webinar series, and we do appreciate everyone from the New Jersey Manufacturing Association joining us today. If you would like to follow us, you can do so on Twitter at Firestorm Soul, on Facebook at Firestorm Solutions. If you have a question during a session, you can hashtag Crisis Coach in any of the social media applications, and we'll see that and get back to you. As always, you can email us at webinars@firestorm.com, and we have some terrific principals on the call today that you can contact directly as well. As you know, Firestorm transforms crisis into value. We empower you to manage risk and crisis, and our expertise is in crisis management, critical decision support, crisis communications, crisis public relations, and consequence management. We are your crisis coach, and our expertise is in crisis and risk. Our attorneys like us to tell you that this presentation is not complete without accompanying oral comments and discussion, and any work product provided by Firestorm must be read in conjunction with guidance given by national, regional, or local authorities, as well as your company's own personal counsel. Moreover, the information given and comments made in this webinar should not be interpreted as any legal advice or legal opinion. I'd like to introduce our guest moderators who will join us and comment throughout the session as well. First, Joe Caratanudo, who is from the NJMEP. And Joe, would you like to say a couple of words and introduce your cohort in crime, Blair Neville?
Sure. For those that aren't familiar, my name is Joe Caratanudo, and I'm with the New Jersey Manufacturing Extension Program. Our focus is to work with small and mid-sized manufacturers to help them become more productive, more efficient, and more globally competitive in what they do. And we do it through a host of different services that we provide. For example, we help companies with lean manufacturing process improvements using Six Sigma methodology. We also help companies with certifications like ISO and compliance, in addition to strategic planning, looking at energy and transportation costs, and helping companies to stay more competitive in that regard as well. And of course, we do business continuity planning in conjunction with my cohort, Blair. So Blair, over to you.
Thanks, Joe. Appreciate it. I just want to take just a quick moment and thank the MEP, New Jersey MEP, for their support. Business continuity is something that is relevant to every company, manufacturers, all companies, and their commitment to it and their energy behind these webinars has gone a long way for their clients and all the companies that do attend. And I think this is an interesting session we're going to have today, especially for the smaller to medium-sized businesses that might be on the phone, given that there's not a lot of as companies kind of downsize a little bit and hold cost. If a number of your employees can't get to work or unable to get to work, there's not a lot of people to backfill. So it becomes an interesting question. You get into things like cross-training and what's our bench strength look like, and we'll get into kind of some of those topics and issues as we go through this. So I think it'll be very important, and especially in this season as we move forward. So again, Joe, thanks for your time in this, and thank the MEP for their support of this.
Sure.
Thank you so much, Blair and Joe. And Joe, I think this is our 4th year with the MEP, and we appreciate your support of the businesses in your state and how we can help them be more crisis prepared. So thank you both for the support.
It's a great partnership.
It is. That's me on the left, and that haircut didn't work out, so I just want you to know I'm growing that out. And I'd also like to introduce you to Ken Mercer. Ken is a principal with Firestorm, and there's a very specific reason Ken is on this session today regarding communicable illness. Ken, would you like to talk a little bit about what your expertise in this field is?
Good morning, Karen, and thank you again to the New Jersey MEP for sponsoring this. I'm a graduate of West Virginia University with a degree in pharmacy. I'm a licensed pharmacist in 3 states, but practice in Maryland. I live in Baltimore, have 3 kids and 2 grandkids. In fact, one of my children is my Firestorm business partner. Some of you may have interacted with Ryan Mercer over the phone the past few years. I was recently appointed to the Academic Advisory Committee of the Emergency Management Program at the Frederick Community College. They offer 2-year associate's degrees in emergency management, both traditional on-campus programs and online programs. For anyone who is interested in this course of study, I'd encourage you to check them out. And you can feel free to contact me for further information. My email address is on the screen. Thank you.
Thank you so much, Ken. And let's talk a little bit about what it is we're talking about today. For all of those of you who are on this call and have joined us for previous sessions this year, the last couple of sessions we talked about, first, natural disasters and how you keep your business running for a significant event. And then we talked about alternate ways to continue your processes, and were there other places where your folks could work, and was your water usable for your manufacturing processes, and could people get to work? So today we're going to talk about a combination of some of the information from our past sessions, and now what do we do when it affects the health and well-being of your employees. And we're going to also make sure that we understand it's not just about communicable illness in the flu season, and I know there's a mumps outbreak going on in a couple of different places in the country, but also if there is a significant weather or natural disaster event, how will that affect the health and well-being of your employees? From everything from physically not being able to arrive to work to everything else from insect-borne diseases and fatigue, post-traumatic stress, etc. So we're going to walk through all of that with Ken as our expertise, and Joe and Blair sharing some of their experiences. Last year we did a survey and we asked, have you personally read your organization's communicable illness plan? We reviewed this with, surveyed about, I think there were about 650 folks that were included in this. And basically, almost 40% of folks that attend our sessions regularly said no, they either have never seen a communicable illness plan or didn't know what a communicable illness plan was. Now, we're really pleased to see that more than 50% of respondents said yes, and we review that once a year. That's great progress from past years, and we hope to see this number increase. So thank you for working so hard to make sure that your employees understand your organization's communicable illness plan. And of course, for those of you who need more help or would like more clarification, you have some great experts on the call with you. And what we're talking about when we look at the risk factors of communicable illnesses is not only do we have the normal risk factors that we have to look at as flu season. We'll know how this goes for those of us who have children, or if you have grandchildren, something is going on in the school system and the kids bring it home, and the next thing you know, everybody's at home sick, and your employees can't come to work because they have small ones at home that are ill, or they have become ill themselves. To compound that, in a natural disaster, especially in a flooding situation, there are some significant risks factors that we need to look at. And Ken, would you like to talk a little bit about some of these risk factors on this? And I'll forward to the next slide as we go through. But I know you have some very specific points of view about some of these waterborne and airborne diseases, and especially insect-borne.
Thank you, Karen. So we have our problems listed at the bottom of this, the chart and the risk factors on the left-hand margin. This really all just boils down to displaced people living in tight, crowded spaces. Those spaces usually lack food, they lack clean water, and they lack general cleanliness. Minor illnesses and injuries that aren't treated worsen over time. And in this disaster, the healthcare system as a whole is damaged. We have broken facilities, broken supply chains, and that system is just not capable of keeping up with the needs, the new needs of this population. So that's back to you, Karen.
And as we have seen, especially for flooding events, even in developed countries, mortality rates are found to increase up to 50% in the first year post-flood. After floods, there is an increased risk of disease outbreaks such as those listed here. And for all of you who went through Sandy and saw some of these diseases and situations evolve, you know exactly what we're talking about. Additionally, you have extreme stress on the healthcare system, as Ken mentioned. We also have the psychological distress of survivors. And I think that's not something that should ever be discounted. I was dealing with a client who was in the Boston area, and they were a little frustrated. They were having some challenges at a new position that they had taken in the business continuity field because they had worked in New York, and they were relocated when their home was destroyed during Sandy, and they were just having a little bit of challenge acclimating to a new environment. And that stress affected their work environment. It affected their work production. There was a level of post-traumatic stress that really needed to be dealt with through an EAP program. And he was loath to talk to his employer about it because he didn't want to be perceived as weak, especially in a business continuity role. So we really want to encourage people that we know who have been through significant disasters, that that's a key part of health as well. And then we just are hoping to see better preparedness, not only by organizations that support us, but we know we are our own first responders, right? And we've seen more and more employees from very small employers to enterprise-level organizations really take the health and safety of their employees during natural crisis or communicable illness outbreak very seriously and provide go bags and other resources. So I think that's a great trend that we've seen. Blair, do you have any comments in this area, especially as someone who lives on the Northeast Coast and has experienced some of this firsthand?
Yeah, Karen, probably the biggest thing that for me, and it's something I mentioned earlier, is the fact that that even companies that kind of prepare for these things and and do put some plans in place, it's the fact that if people are ill or affected by this, usually in these events it's a community-wide event. Therefore, their families are affected as well. So it's not that 30% of your or 40% of a workforce would come down with a communicable illness or the flu or be sick, but it can affect 30-40% because kids are home, people have to stay home, grandparents are ill, people have to look at them. So the web gets pretty wide, and so for smaller companies that don't have it, as I said earlier, have a lot of bench strength, the people can you run your business if 30% of your people are affected by this? Not necessarily all sick, because they may be involved with taking care of family members. So the number can get pretty large. And that's kind of the biggest question is something, you know, we'll talk to, but I want to kind of reinforce that it's not just about everyone being ill, it's about it affects an extended family, which again increases the need for planning, increases the concern, the stress, and just the drama and energy around an event like this.
That's absolutely true. I live in a coastal state myself, and it drizzles our downtown floods. And so there are a lot of things that we're used to dealing with here, but even when we have, and we're again, a city that experiences significant flooding quite often, and it continually affects our manufacturers. We have a huge Boeing plant here, and the contingency plans affecting that facility are, they're astronomical and important to the entire community. So Ken, you and I had a good discussion around this slide because, as I mentioned, I live in a coastal state. You are someone who likes to live on the water, and there are a lot of critters that also get displaced during a significant disaster event that can also lend to a challenge with communicable illness. Would you like to talk about some of our little friends here?
Sure. Karen, would you go ahead and move to the next slide? So these are the environments that we're looking at post-flood. Floods are 40% of the worldwide natural disasters, so far and away the most common big problem. And these kinds of things are what you end up with. I want to talk specifically about mosquitoes a little bit. Mosquitoes have been called the deadliest animal in the world. It's due to the diseases they carry. Mosquitoes kill 1 million people in the world annually. About half of those deaths are due to malaria. So while malaria is not prevalent in the United States to a large extent, floods and these kinds of pictures are breeding grounds for mosquitoes and varmints. Photo on the right. When I see that photo, I think of mold. I see wet trash and a whole bunch of it. Again, just good breeding grounds for vectors that carry our problems with us. Molds lead to respiratory problems, asthma, small or chronic diseases that were managed are no longer manageable in displaced communities and with this kind of environment now that you're living in. So, Karen, you can go on.
I'm sorry, I thought I had my cell phone on mute and it rang in the background, so I do apologize for that. And I think that issue with mold is specifically interesting to me, Ken. We have, as I mentioned, in my area, some significant flooding, and I know in the Northeast coast, certainly all along the coast we do. And we've just had a federal program, a federal grant to buy back a group of condominiums that have now flooded 4 times in 4 years. We had a 1,000-year rain event last year. And the problem was no matter how often people were ripping out drywall and replacing it, there was just mold that was growing in the insulation and in the drywall itself. So when all of that got torn out after the last flood and sat in the street, there were respiratory illnesses. Kids in the street playing were having issues. So there's, you know, as Blair mentioned, it's really a spider web of causal effect. So appreciate your insight in that area. And we know this year we've had some real challenges with wildfires as well. And wildfires bring their own sorts of illness. Ken, do you want to speak a little bit to this? It's just some pretty basic things we should look at, but I think some important points nonetheless. Ken,
I'm sorry, Karen. I put my audio on mute. I apologize. Smoky conditions, and this would apply to molds also, environmental hazards, contribute to heart and lung problems, particularly in those individuals who are sensitive and prone to those issues, young children and the elderly. Individuals that, again, are displaced and don't have their medications on hand with them. Again, this disease that was managed is no longer manageable. Asthma is a particular problem in folks that are prone to asthma. There are many allergic triggers for asthma. Molds are these triggers.
And then as we move forward, if there is a wildfire event, I remember sometime, just the last couple of years, there were some significant fires in Florida, and we were getting really smoky conditions here in South Carolina as a result of that. So there was a significant no burn order for leaves or debris or anything like that. And at the time, I had an elderly relative and who I was a caregiver for, and my husband was recovering from a significant illness. And we were really having challenges with the air and the air quality. So we just didn't do anything that burned. We didn't use our fireplace. We didn't use candles. We didn't vacuum because it stirs up dust in the air until the situation had resolved. And certainly, if you're a smoker, quit smoking if you can, and certainly don't smoke in a home or when there is a significant fire risk. And those are just some of the things that have been going on across the country. Blair, I think I might have heard you come off mute for a second.
Yeah, I just, you did actually, and I wanted to mention this because it's a bit like the law of unintended consequences. I've been speaking with a bank in California the last few weeks, and they dealt with the wildfires. They had branches in that particular area, so they obviously invoked their continuity plan and dealt with the branch personnel and the recovery process. So that's the good side of it. But in speaking to them, and it's interesting you mention it, Ken, is they're now dealing with the fact that there's a lot of illness due to bronchial issues. So they're having to bring personnel out of the home office into the branches to keep them open because people were affected by the smoke and didn't get out. And again, something they had planned for, which now it's a sizable institution, so they can they can deal with it. But it was a surprise to them in that they saw a fair number of their branches that were affected by this, that they're having to go get personnel and bring them in while people are still recovering from it.
That's a really great observation.
Yeah.
I think there are so many other areas of this that we could go into when it comes to supplier resiliency, and just because your area of the country is not being affected by some of these conditions doesn't mean that your business isn't going to be affected by it. So staying aware of what's going on, how you can assist, and again, how you can keep your employees healthy and safe at work is very important. So we just want to recap what happens in natural disasters and why health risks increase. And we know that one of the number one issues is that we have standing water, floodwaters, and open wounds. Even if those wounds aren't significant, they can become significant. Poisoning from a variety of sources, especially dated foods, lack of electricity, and other gastrointestinal infections from poor water conditions and all of those types of things are going to increase soon after storms. As Ken mentioned, we have mosquitoes. And, after Matthew came through this area where I live, we had a significantly different breed of mosquito. We've already got a lot, mosquitoes are an issue, but we suddenly had mosquitoes that were as big as bees. And so if you've ever seen the movie The In-Laws, where they talk about mosquitoes that carry off small children, that's kind of what we were experiencing. Certainly have many first aid. Blair, is that you? Did you want to say
No, I was
something?
just going to say that I was just going to say you're talking about Canadian mosquitoes.
Oh, is that what that? Okay. So we want to look at open wounds. Look at your team. Look at your staff. Health in your manufacturing facilities is so critically important. And if we see something, we really need to help our employees, especially because they may not want to share that information. But if it affects their health or the health of their coworkers, we really need to. There's a breakdown in water sanitation. We know that, and that's the #1 cause. We see diabetes related complications increase. So if you have people who have existing conditions and suddenly there is a natural disaster or a flooding event or another weather event, we need to pay special attention to those folks and make sure they have the health services that they need. And again, we need to look for exhaustion. Now, I'm showing you this image for a reason, and I don't know if you've ever seen it before, but this is an image that one would hope we would have learned from. This is a group of senior and elderly patients that are being transported from an affected elder care facility. And because they didn't have any really good way to transport these folks, they put them on stretchers and then loaded them onto a luggage cart at the airport. This happened in Hurricane Rita, and I believe that was 2005. So we've learned a lot from then, right? Well, apparently not. Ken, do you want to speak a little bit to what the CMS rule is? Just very short. It may not affect our manufacturing folks on the phone, but they may be able to, they may have neighbors who have healthcare facilities that may benefit from some of this information. Or not.
I'm sorry, Karen. This image is from Houston, and it was in the aftermath of the flood there. The CMS, it stands for Centers for Medicare Medicaid Services. This is the payer, the insurance company for about 1/3 of the entire American population. The CMS did not think that our healthcare system is built and prepared for disasters, and photos like this one reinforce that. Several years ago, they wrote a rule to require emergency preparedness plans in 17 new types of healthcare institutions. Long-term care facilities being one, as in the photo that we see here, dialysis centers, hospice, home health agencies. There are quite a few new organizations that did not have this rule, this requirement in the past. Hospitals have had these kinds of requirements, but most of the healthcare community did not. So this rule is coming next week. It will be enforceable. It is something, it's just an illustration that our healthcare system is not capable, particularly in a disaster like this one, of meeting the needs of the people. You are your own first responder. You take care of your own needs.
And actually, when I created the deck, we had about 8 days left. Currently, we have 6 days left, 6.5 days left. And what we believe is if we see this happening in healthcare facilities, it started in California, just in the state, and then it went to the federal level. We're seeing that same thing happen in workplace violence initiatives and workplace violence prevention initiatives. So stay tuned, and we may see other initiatives that are like, not just for healthcare facilities, but for all other types of facilities as well. If you'd like more information, certainly you can visit our website. So now that we know we have some of these challenges, let's talk a little bit. Let me get rid of my X sign there. Let's talk a little bit about how your organization can plan for communicable illness. And Blair, would you like to speak a little bit to this area, examining what your management practices and policies are today for especially NJMEP member companies?
Yeah, I think it's important that when companies look at this issue, they look at it at a broader sense. In that, I've talked with companies about this, and they they talk about they may have a nurse on staff. They have help from their HR departments. They during flu seasons they they put in programs on hand washing and awareness, and like I said, if you're a small business or small to medium business, you probably don't have a voluminous communicable illness plan, but you do have some steps and training and some awareness that makes sense for your business. The thing is, you have to start thinking about, as I said before, the spider web. You're a vendor. Your customer concentration can become an issue. You're in someone's supply chain. If you break down, there's a responsibility there. If your supply chain breaks down because a vendor can't supply you, if there's as I say, a natural disaster in an area that your largest suppliers in that area, once the natural disaster is dealt with, doesn't mean that the problems end. So you have to start thinking about how you deal with this. Just not how do I keep my people healthy. That's important, but also it's a broader. There's a broader issue. How could these kinds of problems affect me? So things like addressing absenteeism, addressing again, having people backstop, cross-training are really important areas, because your employees may not be able to get to your facility. Their families may have issues, therefore they're having to stay home and take care of them. Having policies in place that make your employees be, if they are ill, they stay home. That's actually one thing we find, is that you think about people that want to come to work, and if they're not being paid, maybe they're coming to work ill. So you have to look at the policies of, how do you train your people to make sure that if they're ill, they should stay home, because it can kind of spread through your business. And
not only Blair, not only Blair, but the smaller. It's just as important for an enterprise level organization as it is for a small 25-person organization. As a matter of fact, for the 25-person organization, losing 1 or 2 people, or 40% of those 25 people, is significant in its impact on your business. So please don't underestimate the simple things that you can do, like telling your employees, stay home when you're sick. We need you to do that. So make sure you have some sort of policy set up so that you can offer sick days or make it up in some way. Just teach folks the simplest things. Cover your nose and mouth. And if a tissue's not available, cover with your sleeve, not with your hand. That's an important change in training for all of us. And when we look at some of our devices, if you look at your iPhone or your laptop or keyboards or iPads, keep as many alcohol cleaners or lens wipe cleaners for those devices around as possible, so that we're consistently cleaning the devices that people share and use. I worked in a career center for a few months once, and we had a situation with pink eye because someone came into the career center to work on their resume. They let their child use one of the laptops. The child had pink eye. the next thing we knew, we had 32 people in a career center who were trying to find jobs with pink eye. It's really hard to search for a job when you have that going on. So when we talk about that, avoid teacher employees, avoid touching the eyes, nose, or mouth, and clean and disinfect as frequently as possible at home, work, school, especially if someone is indeed ill. And many years ago, I read what I thought. Ken, I'm going to bring you in here right in just a second.
Okay.
I just wanted to say many years ago, I read a really fantastic book I would recommend to anybody. It was called The Great Influenza. And it really just talked about the most basic thing in the world, washing your hands. And Ken, that's where you come in.
Thank you, Karen. I didn't want to miss my chance for my annual pitch for the influenza vaccine. That is the best best way to prevent influenza. It remains the CDC recommendation, and I again personally have taken the influenza vaccine every single year for the last 25 years. I can't overstate how important that is. That's it.
And I have met Ken, and he is a very healthy guy. So we do want to make sure that you, and Ken, I've always chatted with you about this because when it comes to the flu vaccine, I'm one of those people who's allergic to eggs. And there is an alternative for people like me. So encourage your employees to do that. Along with some of these other types of things that you can post within your organizations during this season. Make people aware. Have some chats with people and say, look, your kids are going to be coming home sick with stuff. Let's make sure we're practicing good safety at home, and let's get those vaccines as soon as possible. So some of the points that we want to consider for your organization and can your organization continue your core operations in any way with some services not happening at your facility? Is that possible? What are the least number of employees that you need to have at your facility in order to continue your core operation? And if people could work at home, so if maybe your accounting services or some of your back office services could be relocated to another environment or at home, do you need to put any special considerations into place now in order to make that happen? Do you need a virtual private network to handle confidential data? Is there any other equipment or reimbursement policies that need to be set in place now in anticipation of something like that happening at some point in time? What would be the impact from a loss of water or a loss of electricity or a loss of other utilities and communication capabilities for an extended period of time? When we have either a mass communicable illness outbreak or a natural disaster, we may lose some services in some areas. So have you considered how much time you'll need to recover from that? And have the solutions that you've thought about been tested? Blair, would you like to speak just really briefly to what this little chart on the bottom is? I know you do a lot of assessments with people and you help them decide what kinds of resources are needed. How does a little chart like this help people plan?
Yeah, thank you, Karen. And the little chart that's on the slide is essentially comes out of our business impact assessment or our risk assessment process. So when we work with clients to help them with plans, whether it's a communicable illness or whether it's just a continuity plan, one of the key questions is, what are your key operational processes that have to stay operating, and what's the minimum amount of people and resources that you could could need to keep them that group in operation. So that chart is a way that we work through with you when we do our analysis to find out, what's the minimum, how many people do you need, what's the resources, and it's kind of in a manufacturing environment, it's a little more complex than a lot of other industries because there's a set of support services. You can move your accountants off-site, or you can move maybe some scheduling away, or your HR teams could work from home and those kinds of things. Unfortunately, with a lot of manufacturing groups, and specifically from the NJMEP environment, is that you've got to produce your product on the floor. There's a process. There's an assembly line. There's a manufacturing stream that you just can't move. So that's why this topic becomes a little more critical, in that if those employees can't work on the floor, your production stops. And then if you don't know what resources you need to keep it going, or what the minimum amount of people or critical equipment you need, then you can be hit pretty quickly in that you don't have enough to keep your production flowing. So the first step in this process is understand, what are my critical processes and what do I need to keep them going. And as I say, it's in some industries you can move people away, as Karen said, and they can work off-site. Fortunately, with most manufacturers, you can't do that. It has to be done in your shop. That's your added value and your secret sauce and what you put together in that environment. So you've got to keep it moving.
So if anybody would like more information on a communicable illness plan or program, anyone on this call is available to answer any questions that you have, and you can find a lot of information on the Firestorm.com website. And I wanted to just show you just a high-level view of what some of the contents of a communicable illness plan might look like, but also to help you move your efforts forward. If you go to Firestorm, that's hard to say today for some reason, firestorm.com/illness, we have a paper that we produced last year that's really comprehensive, and it is a compilation of some, not only our internal resources, but experts in this area on how to help you plan for communicable illness in your business environment. And this paper starts off with, okay, let's just start off with the flu. What do we need our communicable illness plan to cover? And then we go through questions and answers. It's about 30 pages of attendance and leave policies. What happens if you need to do any RIFs or layoffs or terminations as a result of maybe a loss of a contract or loss of work? We don't want to see that happening, but something could. What are the rules around sending workers home or requiring them to stay? Sorry. What about people who refuse to work or conduct business travel to certain geographic locations that may be having an outbreak? What are the pay policies, work restrictions? Do you have any telework or social distancing programs or policies in place? What about customer-facing issues or concerns? How do your benefit plans address this? Employee assistance program assistance, visitor policies, and then all these written policies for your employees. What we want you to do is what we ask you to do for everything, and that's predict, plan, perform. We want you to predict the vulnerabilities, identify your key personnel, supply chain needs, communication requirements, infrastructure, etc. Mainly, we want you to understand the gaps. And the plan phase is where you develop the strategy, you construct the plans that are appropriate and sized for your organization. And that's where you need the help of someone who's really done this before. And the perform phase then establishes the protocols for how you implement. You know, what we've seen in so many programs is that they tell you what to do, but they don't tell you how to do it. So we're trying to give you the tools to tell you how to do it. And then we want you to test it. We want you to audit it, review it, update it, and make sure you're compliant. Ken, we're at the end of our session today. We've got one more minute. Would you like to say something in closing to our audience? And then Blair and Joe, I'm going to ask you the same.
Thank you, Karen. Sorry about that. We've talked to two different audiences today. We've talked to a business audience, folks running their business, and advised to spend some time and thought in what you need to keep your business running and how you'll go about doing that if personnel aren't available to you. And the second audience we've talked to is on a personal level, what you should do, what you can do to keep yourself out of some of the jams that we saw in the earlier slideshow. So I'll give one quick plug for our book. We have a free book that is downloadable on our website, the Firestorm.com website. It's called Disaster Ready People. It's free, and it will help each individual prepare a go bag, prepare a plan for themselves, what they're going to need to have, what they'll need to think about in the event of a disaster. So that's it, Karen. Thank you.
Thank you so much, Ken. That's a great point. Go to our website, just type in under the search the book or go under resources and you'll find it. Blair, Joe, any closing remarks? Blair, I'll go to you first.
Yeah, I just want to reinforce that, two things here. One is kind of training and awareness, and I think from the companies that are on the phone is that you want to do the best for your employees. So helping them understand the risks, just signs and awareness really is something that's important. But don't also lose sight of the fact that you're typically in a supply chain somewhere. You're delivering a service or a product to somebody, and vice versa. You have a supply chain, and you have to be aware that those companies and firms can also be affected by this, which in turn affects you. So again, awareness, ask the questions, and just understand that there's a law of, as I say, a law of unintended consequences, in that something happens in California can create a ripple effect, which can affect you because you can't get your product or supply, which in turn affects your clients. So again, if you're aware of it and can be in front of it and ask the questions, then it's better for your business.
And Mr. Caratanudo, always a pleasure.
Yes, I'd just like to remind, as in closing here, is that manufacturers in New Jersey can take advantage of a no-cost risk assessment for business continuity planning, and they can request that through NJMEP.org, and Blair and I will be down to do the assessment.
Great. Thanks, Joe.
That's fantastic. Thank you, everyone. This has been a great conversation. Hope you've learned some things that you can do to keep your employees and yourself safer during flu season and when there's a natural disaster. This will conclude our session for today. A webinar brief will be available sometime in the next 10 days, and we'll let you know. And until then, you can reach us at webinars@firestorm.com or our 1-800 number, or any of our principals, Blair Neville, B. Neville at firestorm.com, or K. Mercer at firestorm.com. Thanks so much, folks. This will conclude our session for today. Have a great day.
Great. Thank you.